Come in.
Hello there, Mr. Trump. Nice to see you back.
It's Minhada. Nice to see you.
Okay, well, since we've already done your history and physical last week, I think it makes sense that we move forward and do your head-to-toe assessment.
All right, that's fine with me.
Yeah, so we can kind of look if there's anything abnormal and if anything needs to be followed up. How does that sound?
I agree to that. That would be great.
Excellent. So I'm going to begin by just looking at you from your head to your toe. I'm looking at your head, and it's proportional to the rest of your body, and we call that normocephalic. I'm looking for symmetry of the eyes, eyebrows, and the nose, nasolabial folds, and it appears that everything is where it should be. Okay, so nothing abnormal there.
Good
Now,
to hear.
yes, can you smile for me? Frown. Close your eyes tight, puff out your cheeks, stick out your tongue, and that indicates cranial nerve number 7 is intact.
All right.
All right. Now I'm going to just examine your head a little bit further. I'm looking for any lumps, bumps, infestations, protrusions, indentations or lesions, and I don't see any. Except we have a little hair loss up here.
Yes.
When did this start?
That started way back in college when I was a freshman.
Okay, well, it's not
Or
very
sophomore in
uncommon,
college.
so.
Yeah, it doesn't bother me. So.
Okay, well, that's good. All right, so I'm going to palpate your maxillary and frontal sinuses, and all you should be feeling is some firm pressure.
Okay, I'm feeling the pressure.
Okay, how about the pain? Any pain?
No pain.
No pain. Excellent. Now I'm going to check your temporomandibular joint. Open your mouth for me.
Okay.
You already did that. No crepitations or pain.
No pain.
Excellent. Okay, now I'm going to look at your ears, and I'm looking for any discolorations, lesions. There's none. No piercing over here. What's up with that?
I meant to get that piercing, but I'm waiting until my late senior years.
Okay. So I'm looking behind your ears, and sometimes when people have oxygen therapy, they tend to have pressure sores over here, which you don't have. Okay. I'm going to whisper 3 words and ask you to repeat them, okay?
All right. 3 black wolves. 1 big ice cream.
Okay. So your gross hearing is intact.
Okay, that's good to hear.
Yes. I'm palpating the nose. Does anything hurt? It's in the midline. It's like a triangular organ at the center of your face. Any pain?
No pain there.
Can you close one of your nostrils?
Yeah.
Okay, inhale. Patent.
Feels clear.
Okay, how about the other one?
Also clear.
Very nice. Okay. Now I'm going to look at your eyes, and I'm inspecting your conjunctiva, and it's pink and moist. Your sclera is pearly white. That's a good sign. Okay?
All right.
Now I'm going to test 6 cardinal positions of gaze, and this will test cranial nerve 2, 3, and 6. So while you keep your head steady, I'm going to ask you to follow this pen. 2, 3, 1, 2, 3. Okay, perfect. Now, I see conversion of the eyes as I do this.
That's
Okay?
could give me a headache. Too much of that.
I apologize for that. Okay, now I'm going to add, do you wear glasses?
I do. I have reading glasses.
Okay, so do you mind putting them on and
Oh, I
just
can do
read
that.
like the first sentence here?
Okay, it says inspect skin characteristics.
Okay, that's exactly what it says.
Okay.
Excellent. As I'm moving down, I'm gonna look at your mouth and your throat. So your mouth is pink, it's moist. I'm gonna need a pair of gloves for this.
Okay.
Okay. Right. Okay. And can I ask you to open your mouth? All right. Now I'm looking at buccal mucosa over here, and it's glistening and pink, no loose teeth. There's one dark tooth over here. Can you tell me more about what's going on here?
I was in a fight when I was in second grade and chipped the tooth, and then I developed an infection in the root, and so the tooth died. But it's still sturdy. It's still firmly in my mouth.
Okay.
So I'm going to get that corrected shortly.
Okay, excellent. So you have already followed up. I'm looking at your gums. There's no abscesses. I don't see any gum disease, no inflammation, no redness. And I'm also looking underneath your tongue because this is where some of the oral cancers can begin. But you're lucky because there's nothing there.
Okay, great. Good to hear.
Your tongue is pink and rough, and that's normal. If I were to see a strawberry tongue, I would think of Kawasaki disease. So you are fine.
All right. Phew.
Okay. Now, can you say ah? Oh, okay, great. So I see the uvula, and that takes that tests cranial nerve number 9 and 10, which are intact.
Okay.
Okay. Moving down. So I'm looking for any swelling around your neck. Usually, if you have like goiter, you would have a big mass here. It's like iodine deficiency when the thyroid swells up. Can you swallow? Okay, perfect. So it moves up as it should. Trachea is in the midline. Okay. I'm going to palpate your lymph nodes.
Okay.
Okay. So we have preauricular, postauricular. Then we have jugulodynastic, submandibular, submental. We have cervical. Then we have supraclavicular and infraclavicular. There's no swelling or anything like that, okay?
All right.
I will just move up because I need to see your pupils,
Okay.
okay? So I'm expecting to see the pupil constrict, which it does. And same for the other ones, and your pupils are equal and reactive to light and accommodation. Okay, moving on.
Okay.
Now I'm gonna ask you, can you shrug your shoulders? Okay, perfect. Now I want to test your range of motion of the neck. Can you go?
Mm-hmm.
There you go, left, right, up and down, and the range of motion is intact.
Okay.
Okay. Now we're gonna move down to your respiratory system. So I'm looking for symmetry, and just by observing your chest, I see it's relaxed, it's easy, there's no use of accessory muscles. If I was looking at the COPD patient, I would see a barrel chest. I'm assuming you're not a smoker, you've never
Never really smoked.
never smoked. Okay, very nice. And this is a good time for me also to inspect the skin of the trunk. Sometimes people do have moles on the back, and I see you have quite a few of them yourself on the back.
Yeah, from some sun when I was, especially when I was younger.
Okay.
A lot of sun from sailing a little sailboat.
Yeah, that'll do it. So I'm going to listen to your breath sounds.
Okay.
Okay. because the right lobe has 3 lobes. You have to hear it all over.
Okay.
Okay. Now lift this up. Here we go. Over here. And then we're listening over here. Excellent. I don't hear any adventitious breath sounds.
All right. That sounds
Okay. Now I'm
healthy.
going to palpate for lung expansion. As I put it's almost like a butterfly. I'm going to ask you to inhale deeply. And there's the equal expansion of my hands. Okay.
All right.
Now we're moving to percussion. Okay. If you don't mind, you can just lay
All right.
back. I'm gonna percuss. Okay, so what I'm hearing is resonance, and that's a good thing. If it was dull, that would usually indicate a fluid. We don't have that, so we are okay.
No fluid buildup.
No fluid buildup, that's a good thing. Okay, now I'm gonna listen to the aortic valve, which is second and third right intercostal space, pulmonic valve, which is second and third left interspace, and then we have tricuspid valve, left sternal border, and then finally the mitral valve, which is down here. Okay, excellent. So no bleeds, no S3 gallops, murmurs. I don't hear any of that, so that's usually a good sign. We hear S1, which is the closure of atrioventricular valves, and S2, which is the closure of aortic and pulmonary valves. Okay.
I guess there are a lot of ways the heart can be irregular.
Yeah. Okay, so I'm going to inspect, since I'm in this area, your upper extremities, and I'm looking for any like skin abnormalities, lesions. I'm going to also palpate the radial pulse, the brachial. Okay. Okay, palpable. No edema. I'm looking at your fingertips. It's brisk, less than 2 seconds. Capillary refill. It's a good sign. Now, do me a favor. Pull.
Okay.
Push. Excellent. So that's equal strength in both extremities. Okay. So we're gonna move down.
All right.
Okay. Now we're in this area, and when we're looking at the abdomen, I'm looking at for cantor symmetry. Umbilicus is in the center, and then I'm going to listen to aortic pulsations, which is a couple of centimeters above the umbilicus.
Breathe in and out.
And then renal artery, and I hear no bruits or anything like that. That's a good thing.
Glad to hear
The
that.
important thing about the abdominal assessment is that we don't want to palpate before we auscultate, because we might move things around and screw the results. Okay?
All right.
So
Glad
I'm
you
going to listen
Thinking
to
of that.
vowel sounds
Okay.
in all 4 quadrants. Okay, you have hypoactive vowel sounds. Do you have constipation or?
Sometimes I do.
Sometimes.
Yeah.
Okay, so it's important for you to develop a bowel regimen where you go regularly, and you might want to increase your fluid intake and fiber. If that doesn't work, then you might have to add like folates or senna or something like
Okay.
that. Okay.
That's a good reminder.
We'll follow up on that.
All right.
Okay. All right. So since I'm still in this area, I do want to look at the breast. Now we're looking at the size and symmetry. Do me a favor and put your arms above your head at the hips. So I'm looking for retractions or dimpling, okay, while those moves are being made.
Okay.
I'm gonna palpate for your axillary lymph node, okay? And then there's central and supraclavicular and infraclavicular. Okay, nothing is swollen, that's a good thing. Okay?
Okay.
So generally we would palpate the breast from the tail of Spence going in a vertical direction and we're looking for lumps, anything like that, then we would have to follow up, okay?
All right.
All right. So we're gonna move down to your lower extremities, and I'm basically looking for any swelling. Again, I'm inspecting the feet, looking for hair loss, which would be indicative of peripheral vascular disease. I'm checking the pulses. They're strong, palpable on both extremities. There's no edema. Now do me a favor and push. Great. Put your feet up for 10 seconds.
Both of them?
One at a time. 1, 2, 3, 4, 10. Now the other one.
Okay.
Okay. No. Okay, push. Okay. So it's strong
Okay.
on both. Okay. Now we're gonna move to the neuro assessment. So neuro assessment usually begins at the minute I walk in. You're responding to me. You told me you're Mr. Trump, your date of birth, where you're at. So your eyes are opening spontaneously. You're alert to person, place, and time. So now I'm going to ask you to close your eyes.
Okay.
And tell me, just say now as you, when you feel this.
Now. 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 Now.
Okay, perfect. I did forget one thing to do with your chest, so if you want to move forward,
Okay.
we're gonna do what's it called? Tactile fremitus, which you're gonna say 99, and I'm gonna palpate. Just say 99.
99. Keep saying it.
Yes.
99.
Mhm.
99. 99. 99.
Okay, excellent. So these are the vibration of chest wall resulting from the speech. Okay. I'm gonna have a sharp and a dull object. So this is, close your eyes, this is sharp, this is dull.
Okay.
You tell me when it's sharp, when it's dull.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. I can't feel that. It's too many genes on there.
Okay. All right. Now I'm gonna test your the reflex.
Leg reflex or arm? Or?
Yes, deep tendon reflex and patellar reflex. So I'm gonna have a hammer.
Okay.
And
Be easy on me with that.
okay, so we're just gonna have like a hammer, and as I like poof, you're gonna go.
Okay.
There we go. Doof. Oh, there it is. And then we're gonna do another one here. Oh, there it is. Both reflexes are active. Okay. ask you to stand up,
Okay.
okay? And as you're standing, I'm looking for swinging. Close your eyes. Rosenberg's assessment. Okay. Now do me a favor, walk in front a little bit.
That way?
Yes. Okay. Perfect. Perfect. Now, Romberg test we did. Now walk towards. Walk back. Now, can you do me a favor and bend? Come over here
Okay.
and bend over by touching your toes.
Okay.
With your spine straight, and as you can see, like the spine straight. I don't see any like scoliosis or anything, so that's a good thing. Okay.
All right. Yeah, I can't quite touch my toes, but after I count to 100, I can usually get to the toes.
Okay. Excellent. We did the Romberg test, and you may have a seat.
Okay.
Okay. And that completes our head to toe assessment.
All right. I feel great that you did such a thorough evaluation. Thank you.
Oh, you're very welcome. I don't feel so great.